Now we will be covering the class Betaproteobacteria, order Neisseria, family Neisseriaceae, and the genus Neisseria. So, Neisseria is a gram-negative aerobic cocci, often arranged in pairs. They are oxidase positive, non-motile, non-spore-forming, and non-acid fast. They have capsules and pili. Neisseria is a mucosal parasite that dies rapidly outside the human organism, and culturing is feasible. Under Neisseria, we have Neisseria gonorrhoeae or gonococcus that causes the sexually transmitted disease gonorrhea, whereas we also have Neisseria meningitidis, also known as meningococcus, that causes both meningitis and bacteremia. Neisseria gonorrhoeae is not a normal flora and is an obligate pathogen. It was first described by A. Neisser in 1879, first cultured in 1885, and is responsible for gonorrhea, or also known as CLAP. The bacteria adhere to cells of urogenital tract by attachment pili and the protein OPA. Penetrate by endocytosis, then multiplies and grows inside epithelial cells. Rapid growth of the bacteria will destroy the cells and release more gonococci to spread to deeper structures, example fallopian tubes and prostate. Sometimes blood infection or bacteremia occurs and is known as disseminated gonococcal infection. So, under microscopy, you will be able to see gram-negative diplococci in phagocytes. Neisseria gonorrhoeae grows only on special medium, example Thea martin agar, and requires a kept-lit environment from 2 to 8% of CO2. For differentiation, the following sugar utilization tests can be used, and Neisseria gonorrhoeae will produce this profile. For men, the primary site of infection is the urethra, where symptoms surface after 2 to 7 days of infection. There is purulent urethral discharge and dysuria, or pain when urination. For women, primary site of infection is the endocervix, with mild or absent symptoms include increased vaginal discharge, urinary frequency increase, dysuria, menstrual abnormalities. For asymptomatic mothers, sometimes the infants can get infected and will have purulent conjunctivitis, which can cause blindness. But to prevent this, newborn babies are given eye drops. Asymptomatic male and females are the major reservoir for this bacteria, and one characteristic of this Neisseria gonorrhoeae infection is the high prevalence but low mortality. The therapeutic of choice is penicillin G, although penicillinase producing Neisseria gonorrhoeae have appeared.
Neisseria meningitidis or meningococci is a pathogen of the nasopharyngeal mucosa and causes meningitis and sepsis. So diagnosis is usually via direct detection of pathogens in the cerebrospinal fluid and blood. So you'll see the bean-shaped cocci here, and occurs sporadically in the form of minor epidemics, especially in closed quarters, army barracks. Neisseria meningitidis grows also on blood agar, so unlike Neisseria gonorrhoeae that grows only on chocolate agar, and CO2 enhances growth, but it's not required, but CO2 is required for Neisseria gonorrhoeae. So for differentiation, the same set of sugar utilization tests, and for Neisseria meningitidis, you have obtained this pattern. Neisseria meningitidis has 12 serogroups. However, most epidemics are caused by serogroup A and sometimes B. Vaccines are available for these types. So when the virulent meningococci colonize the nasopharyngeal mucosa, our host lacking antibodies, the pathogen invasion is via endocytosis, and then the bacteria moves to the central nervous system. The bacteria can also infect lungs, endocardium, and joints. Incubation period of about 2 to 3 days. Symptoms in a less than 2-month-old baby, usually no fever, but severe headache, neck stiffness, vomiting, hypothermia, apnea, seizures, and coma. For Neisseria meningitidis infections, one of the characteristics is their low prevalence but high mortality. This is in contrast to Neisseria gonorrhoeae that has high prevalence but low mortality. So Neisseria meningitidis have carrier rates of 5 to 15% and is exclusive on humans. Transmission is by respiratory droplets, and susceptibility is usually for immune suppressed or children below 2 years old. So usually we'll get minor epidemics in work camps, recruiting camps, army barracks. Lethality is 85% if untreated, but 1% if treated early. So treatment, we have penicillin G and also third generation cephalosporins. It's important to start treatment early to prevent delayed damage. So other than Neisseria, we also have Kingella under the family Neisseria. Kingella is a short bacilli or coccoid bacteria, oxidase positive, non-motile, and is an opportunistic pathogen. We have Kingella kingae and Kingella denitrificans. It's a normal oral flora but can cause infections of bones, joints, and tendons. It's in the HASEC group and also causes infective endocarditis and susceptible to penicillin, ampicillin, and erythromycin. So you can see it causes rare cases of endocarditis, arthritis, osteomyelitis. Next, we'll look at the order Burkholderia, still under the class Betaproteobacteria. We'll look at the family Burkholderiaceae and the genus Burkholderia. So Burkholderia, the type species is Burkholderia pseudomallei, previously known as Pseudomonas pseudomallei. It is a gram-negative rod, oxidase positive, motile, non-spore forming, non-acid fast, and produces gram-negative bipolar staining. So if you look carefully, you can see that the ends of the cells are deeper in stain. So it can grow on blood agar, McConkey, eosin blue agar, etc. The selective medium is Ashdown's medium, and detection is usually complete screening, which means it can be detected from blood, sputum, urine, throat swab, and culture of pus. It's an environmental organism that is an accidental pathogen. It is in the soils, in water, and because it is able to invade cells, polymerize actin, and causing cell fusion and formation of multinucleic cells, and is able to spread from cells to cells, is able to be present in all types of organs and all types of systems. That's why detection can be carried out from complete screening. It is available in your blood, can be found in the blood, sputum, urine, and pus. So it is endemic in Southeast Asia, Taiwan, and Northern Australia. The infection can be either through a break in skin, inhalation of aerosolized bacteria. Melioidosis is a recognized disease in animals, but in humans, symptoms may include pain in chest, bones, joints, cough, skin infections, lung nodules, pneumonia, and a very high mortality rate even with treatment. There is also increased risk factor for patients with diabetes, thalassemia, and kidney disease. For Burkholderia malae is a causative organism in Malleus or glandus. While people can get the disease, this disease is more important in horses. It also affects donkeys, mules, and also other mammals. Sometimes cross-infection, it can invade humans through skin, mucosa, and form local ulcers. Then it can spread to other organs, either through the lymphatic system or through the bloodstream. Under the order Burkholderia, we also have another family, Neisseria, and the genus Bordetella. So Bordetella is a gram-negative, aerobic, encapsulated cocobacilli. The type species is Bordetella pertusis that causes pertusis or whooping cough. So when you're breathing in, the patient will have a whoop sound. It was first isolated by Jules Bordet and Octave Gengu in 1906. It is airborne, incubation period of 7 to 10 days with humans as the only known reservoir. This is a highly contagious respiratory disease, important in infants, elderly, and pregnant women. It secretes adhesins and toxins that cause local and systemic cytopathogenic effects observed during the disease. The portal of entry is inhalation. You'll have signs and symptoms resembling common cold for 1 or 2 weeks, and then the next 2 to 4 weeks is characterized by persistent, violent coughing that consists of 3 or 4 coughs without a breath, followed by a high-pitched wheezing, inhalation, or whoop. Okay, so this will last several weeks as the cough subsides. Susceptibility is in unimmunized children. We can actually prevent it by taking the vaccine. So in the past, it kills 10,000 to 20,000 per year in US before the vaccine, but now less than 100 die per year. Okay, so in England, after vaccination, infection rate has dropped by 97%. That's why the vaccines are important and useful in this kind of situations. So previously the vaccines are whole cell vaccines, but now they are purified surface antigens and are acellular. It is also part of the DTaP vaccine that is in the immunization schedule in Malaysia. So the vaccine vaccinates against diphtheria, tetanus, and pertussis. We have sporadic cases now among those that are not vaccinated and cause infection clusters. So vaccination is mainly to protect infants because they are most vulnerable. Okay, so the twins from 11 to 18 years old with faded immunity is also vulnerable. That's why vaccination should be adopted by everyone to control this disease. For diagnosis, a nasopharyngeal swab on Bordetella ganguiaga will show small circular pulvinic colonies, motile, oxidase positive, urease negative, and citrate negative. Treatment can be with macrolides, for example erythromycin.